your girl Bree Nicole, and I'm back with another video. And in this video, I'm going to be talking about my LPN program more in depth. That video got a lot of views, and a lot of people still had a lot of questions for me. So what I'm going to do is just break down each semester into 3 separate videos. My program was 3 semesters long, not including the prereqs that I took. But I'm just going to talk about like what we did in the actual nursing program. So this is going to be semester 1. Okay, I started in the summer semester of 2017, and then my second semester was in the fall, and then our last semester was in May of 2018. So that's how my program went. When I applied for this program, I applied in February. I got my acceptance letter in like the last week of March. We had like an orientation in April, and then we started school in May. So the first semester was fundamentals of nursing, and we basically learned like the basic foundations of nursing this first semester. So we had class 4 days a week because summer semester is shorter, so we had to go more days out the week. We actually had class 2 days. Class was from 8 to 11, but if we had a test, we had an extra hour. So if it was a test day, class would be from 8 to 12, and we would just use that extra hour for testing. But normally just class days were 8 to 11. The other 2 days were lab days, and they were 8 to 4:30. So we had like 8 hours to do labs and practice skills. The first day of class, we got a syllabus talking about everything we needed to know about this program. They told us we could only miss 3 days of class and like 1 day of clinical. So those were the amount of days that you got to miss. They talked about we had to make a 75 or above to pass each semester of their program. And they just talked about pretty much like the basic syllabus stuff. They go over like what you're going to be learning, what they expect out of you and everything. They gave us calendars. They uploaded all this into Canvas. It was a calendar, and what I'd like to do was print my calendar off that they made for us, and I would put it in the front of my binder each semester, because it had the class days, the test days, it had what we were going to be learning, what we're going to be practicing on each skill day. Like they had it all listed out, like and I may screenshot it and put it like here so y'all can see. Our teacher did this for us. It didn't have clinical days because of course everybody had different clinical sites. So what they told us to do is go look at the clinical schedule, which they posted separately, and they would say write down your clinical days on this calendar so that you can have everything down for the whole semester. So things that we learned this first semester, we learned like the basic foundations of nursing. Like I said, we learned ADLs, like about getting a patient dressed, changing a bed with a patient in the bed, like how to roll a patient, turn a patient. We learned about basic stuff like that, and I'm going to try to go through my old syllabus. I tried to like go back and screenshot some stuff because I still have access to it right now. So I'm just going to go through and read all of that stuff. So we learned about health promotion, mobility, and these are just concepts. We learned about beds and bath safety, how to like mobilize a patient safely, how to like ambulate a patient safely to the bathroom or just up to the chair. We talked about safety and infection control, the nursing process, and then like on lab days, they have listed what we were learning and practicing on lab days: vital signs, dosage calculations, medication administration. We learned about professionalism, let's see, P's dosage calculations, NG tubes, clean dressing changes, elimination, which is like renal function, documentation, oxygenation. And then they have the days that we had checkoffs. So they have like vital sign checkoffs, the clean dressing change checkoff, NG tube return checkoff, a head to toe assessment checkoff. And we also talked about comfort care, psychosocial well-being, cultural and spiritual, mental health concepts, grief and loss. And then that's when we started our clinicals. And that was everything. Those were like the concepts we learned. And I'm pretty sure y'all are like, I have no idea what you're talking about. And I really didn't know either. But it's just like simple stuff. But they just listed it by concepts, so it makes it kind of like difficult to understand. But it was just like the basics of nursing. And if you have like a foundations book or a fundamentals book, then you would know what I'm talking about. So a lot of things, I'm just going to go through like what my teachers did for us. So we would have pre-class assignments posted. We had like each class day was broken down into a module on Canvas. So that would be like, okay, on this day we're learning this. So we would open the module and they would have a pre-class assignment in there that they wanted us to do before class started. So we would have an idea of what we're going to be talking about that day. We didn't go into class blind, not knowing like what we're going to be doing. And all the topics were also listed in the syllabus and on the calendar. But this work was just like, it would be like sometimes looking up terms that we were going to be talking about, answering questions. It was just stuff that was like really helpful and helped us like, okay, this is what we're going to be talking about today. And they also posted the PowerPoints that they like went through the day of class. They posted the actual PowerPoints in the modules as well, so we can go back and look at the PowerPoints or print them off. We could print it off before class so we can make notes as we went through. Like I like to do that with my PowerPoints, so I can just add notes that they were talking about in class, or you could just go through the PowerPoints and read off of it at home. It was just up to you. And like the pharmacology and dosage calculations, they were just basic. It was mainly like conversions. They would have us convert like teaspoons to cups or tablespoons to cups. It was like basic conversion, liters to milliliters, stuff like that. It wasn't any like IV math or anything this first semester. And sometimes we would have to do like ratio and proportion, because they would ask us questions about administering pills. So you would have to know like how many pills to give a patient. With the medication administration in the labs, we learned about giving PO meds and sub-Q injections. We did practice that. So we were allowed to, when we started clinical, we were allowed to give PO meds and sub-Q injections like insulin or heparin or Lovenox to patients in this first semester. All of our checkoffs had to be done by June 29th, because in July we started clinicals. We had long-term care clinicals and rehab clinicals. So we only had 6. So they pretty much, the 2 days we were going to lab, those turned into our clinical days in July. So I had 3 clinicals at a long-term care facility, and I had 3 clinicals at a rehab facility. So we practiced like head-to-toe assessments on patients. We gave PO meds, and we got to give insulin if the patient was a diabetic. And we just did like ADLs. We like fed patients that were like fetuses. We did bed baths. We changed linens on the patients. We got them dressed, like also with the help of the CNAs. We didn't do this like alone. And we just pretty much talked with them, and we played games with them, went to their like day room and did stuff with them. We did a lot. Just pretty much getting to like communicate with the patient, and it was really fun, and it was a really good experience, because I probably would have been really nervous if my first clinical would have been like at a hospital, because some schools that come to my hospital, they're like, we're first semester students, and they're like terrified on med-surg. So I'm glad we got to do that in like a nursing home, and we got to see like the patients that were like tube feeders and how that kangaroo pump and stuff worked. So it was just really a really good experience. And like I said, we had to have a 75 to pass. We had, I think, about regular tests, and then we had a final HESI test that we took, and you had to have an average of 75. We didn't have any like classwork besides like the pre-class assignments. We did have some quizzes that we had to do, but it was only 5% of our grades, and the quizzes were really short. They were like 15 question quizzes, and we got to do them at home. It was basically for us to receive like an extra 5 bonus points, which helped us out a lot. So if you didn't do them, you didn't get that 5%, but if you did do all of them and just use your textbook to take the quizzes and make A's, you pretty much got like a free 5 points. So that was like the only extra like grade we had. They mainly wanted us to just have like test grades. And we had ebooks by Lippincott at my school. I know like when I started back the RN program, I think they did away with the ebooks because it was just a lot, because we got like some discs where you had to install the books to your laptop, and a lot of people had trouble that didn't have like enough space on their laptops. They weren't even able to like view the books, so it was just a lot. We didn't even really use those books, to be honest, but that's what our school used. It was a bundle, and it was all of our books for like that whole nursing program. So it had your fundamentals books, med surg books, maternity, peds, all of that, mental health. It was all included, and it was about, I think it was like around like $500 and something for all of that. May have been more. I don't know the exact price, but I know some people didn't even buy the ebook because they couldn't even afford it. But I utilized Fundamentals Success. I used that book, and it had everything that we learned in this program. That book was the truth. One of my classmates put me onto it, and I still would thank him to this day. He put me on a lot of books. So that book, and also the LPN Saunders book. I'm going to put this book here because that book and the Fundamental Success books like really helped me get through this program pretty much. Like, I'm gonna talk about other books like later on in my other videos, but these 2 books were the one that helped me during this first semester. I forgot to say this, they gave us nursing kits. Well, we actually had to buy them. They were $50, but they included like a whole bunch of like needles and everything, that so we could practice our skills at home too. So we had like needles to practice injections. We had to do like sub-Q, IM. I want to say they had like the NG tube stuff in the kits, dressing changes stuff like gauze and tape in the kits, so we could just pretend like we're doing dressing changes. So it included a lot of stuff like that, so we could like practice at home. It just pretty much included everything, like gloves, so you can practice applying like sterile gloves. And also the prereqs that I took before this program even started, I'm just going to list those again, even though I listed it in my previous video. But the prereqs were Bio 201, which was Human Anatomy and Physiology 1, Math 100 or higher. So that was like college algebra. Human and Anatomy and Physiology 2, English 101, Psychology 210, which was growth and development, public speaking. And if you wanted to become an RN, you had to take microbiology and a fine arts elective. So those were the only prereqs needed for this LPN program at my school. I'm trying to think of anything else. So this first semester, we really just learned, like I said, the basics. So we just had to get in a routine of learning to study, having to study like every day, because we had a test pretty much like every 2 weeks during the summer semester because it was so short. But the actual coursework and fundamentals wasn't that hard. It didn't really get hard until med-surg in the next semester. So yeah, guys, this is what we did my first semester of the LPN program. And also we got to dress like in normal clothes for lab. We only had to wear our uniforms and scrubs to clinical and to like final lab checkoffs. But while we were practicing and for class at my school, you could just dress in like normal clothes, because I know like some schools, you have to wear your uniforms to every class day, but it wasn't like that at my school. We got to like dress casual and wear like tights and a t-shirt or shorts or whatever. It has that the cost approximately for this first semester was around like $3,500 to $4,000, and it is the highest semester. It's always, the first is always the highest, because they have like the cost of textbooks and uniforms, software applications, your background check, random drug screen, malpractice insurance, your final exam testing fee. Oh, and they also included health insurance if you don't have your own health insurance. So it probably was around like $3,000 for the first semester of nursing school. So yeah, guys, I think that was pretty much everything that we did in my first semester. If you would like to know anything else, just comment down below and I'll be sure to get back with you. And I'm going to have my second and third semester in future videos. I just wanted to break it up so I wouldn't have like one long video to go like more into depth. So that's all I have for y'all today. Don't forget to like, comment, and subscribe, and let me know what other videos y'all would like to see, and I will be sure to get back with you guys. And I will see y'all in my next video. Bye, guys.